Hello, my name is Guillermina Nava, and I'm the Program Director for the Independent Plastic Surgery Training Program here at Wayne State University and the Detroit Medical Center. This video will introduce the prospective applicant to the program and provide some background information prior to the formal interview process. Our division is part of the Michael and Marion Ilitch Department of Surgery, led by Dr. Donald Weaver, who has served as chairman for over 15 years. He has been a consistent support of the plastic surgery division and our training program throughout his tenure. Dr. Eddie Gersell originally came to the department as a resident in general surgery, stayed on for a plastic surgery fellowship, and later became faculty. He assumed the role of division chief and program director in 1994. In 2018, he stepped down as program director, but continues to serve as chief of the division. I joined the faculty in 2009 after completing my residency at the University of Virginia, following my husband to the great state of Michigan. I was appointed assistant program director in 2015 and took over as program director in 2018. Dr. Faisal Al-Mufaraj is our associate program director of research. He comes to us having completed his training at George Washington University and Mayo Clinic, followed by a craniofacial fellowship at the University of Washington. Our core faculty is composed of an excellent group of well-trained and committed plastic surgeons who bring a depth of experience and training to our program. Many of our faculty have specialized fellowship training, and others have developed clinical interest in specific areas of plastic surgery. Our staff affords the residents a well-rounded clinical experience in a broad spectrum of plastic surgery. We have also developed and maintained strong relationships with many adjunct clinical faculty at the various sites that are part of our training program. Our region has several large healthcare systems in the greater Detroit area. These include the William Beaumont Healthcare System, the Henry Ford Hospital System, and St. John Ascension. Experiences with many of these faculty members also include time in their private offices. Such a varied clinical experience allows the trainee to understand all models of practice for a future plastic surgeon. This includes private practice, academics, hospital employed, and what we call privatedemics. In other words, the private plastic surgeon who's committed to working with and training residents. The home base for our program is the Detroit Medical Center, which is the largest healthcare provider in Southeast Michigan, with more than 2,000 licensed beds and 3,000 affiliated physicians. It serves as an essential referral network for the Southeastern Michigan region. The DMC is also the leading academically integrated system in the metropolitan Detroit region. Along with the other affiliated rotation sites, the DMC serves a diverse socioeconomic demographic, including urban and suburban populations. The DMC consists of multiple hospitals, which are mostly centrally located at the downtown central campus. These include Harper University Hutzel Women's Hospital, Detroit Receiving Hospital, and Children's Hospital. Sinai Grace Hospital is located in Northwest Detroit. There's also an affiliated Rehab Institute of Michigan and the Karmanos Cancer Center, which is headquartered in Detroit and has partnered with the DMC for use of their facilities. It is the largest cancer research and provider network in Michigan and is an NCI institute. This diagram gives you a bird's eye understanding of the downtown central campus and illustrates some areas that had recent renovations done. These include construction of a pediatric specialist facility, a heart hospital with a new outpatient surgical center, and renovated ORs for the Children's Hospital of Michigan. This image illustrates the downtown central campus and how it occupies a large city block, which is all within walking distance. There are also underground tunnels that connect many of the facilities for those cold Michigan winter days. You can also appreciate the proximity of the Veterans Hospital and the Wayne State School of Medicine, including the library and other facilities, which include a cadaver lab. The Harper University Hospital was established in 1863 and is among the oldest U.S. medical teaching institutions. It is a 450-bed private tertiary hospital facility that offers services in a broad range of clinical areas. Our surgeons do the bulk of their elective and reconstructive cases at the Harper University Hospital. We've developed strong relationships with the other surgical specialties who often require assistance in the care of the complex wound. There is also a well-developed bariatric program that refers for body contouring after massive weight loss. As stated before, the Karmanos Cancer Institute is housed within the Harper University Hospital buildings. The staff here treats approximately 12,000 patients a year, and our surgeons participate in the oncologically related reconstructive cases, including breast, orthopedic, gynecologic, urologic, and surgical oncology. Detroit Receiving Hospital was founded in 1915 as a city-owned hospital dedicated to caring for everyone regardless of the ability to pay, and it moved to its present location in 1980. Detroit Receiving Hospital is a 320-bed facility and is the state's first level 1 trauma center. The emergency department treats more than 105,000 patients annually. The hospital also features the state's largest burn center and a hyperbaric chamber. As a major trauma center for the city, it offers a variety of clinical experiences in maxillofacial trauma, hand trauma, complex reconstruction of the trunk and lower extremity, as well as secondary burn reconstruction. The Children's Hospital of Michigan is the first and largest children's hospital in the state, founded in 1886. It is the only freestanding pediatric level 1 trauma center in Michigan. Children's Hospital is home to a team of pediatric subspecialists who are part of the multidisciplinary pediatric plastic and reconstructive surgery team that cares for many conditions, including hemangiomas and vascular malformations, craniosynostosis and plagiocephaly, pediatric burns, craniofacial anomalies, including cleft lip and palate. We also are the primary service and care of the craniofacial trauma patient. Sinai Grace Hospital, again located in Northwest Detroit, is covered for hand surgery and plastic surgery by our staff. The other affiliated sites are listed here. Rotations at Henry Ford and William Beaumont are formally structured rotations working with committed faculty members who are also part of the plastic surgery programs at those institutions. The other sites provide access for case coverage to follow many of our faculty to participate in the care of their patients. In summary, our program provides a broad spectrum of experiences for the trainee in several models of practice over the course of the 3-year program. Annual evaluations of rotations and the resident feedback are used to evaluate the program block structure to assure consistent educational experiences. Our rotational structures vary from year to year, with some experiences scheduled yearly to allow development of independence and autonomy for the trainee. There are some specialty-focused experiences, including rotations with oral surgery, head and neck, oculoplastics, as well as cosmetic-focused blocks in your senior year and an elective month. Like all programs, we have a structured didactic schedule that follows the plastic surgery curriculum. This includes grand rounds, morbidity and mortality, journal club, and an indications conference. Lectures are given by core faculty, adjunct faculty, residents, as well as visiting lecturers. We also have some unique experiences that include a required microsurgery course in the first year done locally. We have participated with the University of Michigan and their mock oral exam for several years. The faculty also serve as volunteers for this exam. Dr. Michael Basuito has structured a program for our residents to learn about the business of plastic surgery. These sessions are done monthly and discuss such topics as employment contracts, coding, securing a bank loan, and practice management. And finally, because of our affiliation with Wayne State University and the Department of Anatomy, we are in the process of developing a FLAP course for the residents with the financial support of the Department of Surgery. Of course, your education is ultimately to lead you to graduate and start a practice and become a board-certified plastic surgeon. For full transparency, our 5-year board pass rate for the written exam is 80%, and the oral exam has been at 90%. This table illustrates the success of our graduates and their career aspirations. All residents who desired further fellowship training were successfully matched in the discipline of their desire. This has included fellowship matches in aesthetics, hand surgery, microsurgery, and craniofacial. Some of those fellowship trained residents have entered academic positions, while others have entered independent private practice or hospital employed opportunities. Many of our previous graduates have gone also to find success in very competitive markets in private practice, and these have included Beverly Hills, Miami, Atlanta, and New York City. I hope this video has provided you some information in preparation for your interviews. If you have any further questions, please do not hesitate to reach out to me or our program coordinator.